Good evening, and thank you so much for joining us. My name is Imani Rupert Gordon, and I'm the Executive Director for Affinity Community Services. We are here every Friday evening talking about issues related to the LGBTQ community. Today, Omaria is helping us out in taking phone calls. So if you'd like to join the conversation, if you have a question for our guests, definitely feel free to call in. We'd love to hear from you. Today we are joined with Jackie Boyd of the Care Plan, who's one of my absolute favorite people in the world. But Jackie is the founder and CEO of the Care Plan. The Care Plan is a care navigation company specializing in LGBTQ plus communities based in Chicago.
Yes.
Lovely. Thank you so much for joining me, Jackie.
Thank you for having me, and hello to the CAN TV community.
Yes. Hi, y'all. So we're going to jump right in, and I want to start off by asking you just about your professional trajectory. I know a lot of people, they want to hear about services and companies that are locally silver in our organization, but also people want to do the work that folks are doing too. So I'm wondering if you can share with us a bit about how you ended up working at the Care Plan and sort of what led you here.
Well, thank you. That's a great question. And I think that what you were inferring about curiosity about people's paths is really a great way to start, because that's what led me to working with older adults and thinking about healthcare and aging in a comprehensive and person-directed way. I started my career as a certified nursing assistant, working in nursing homes and psychiatric facilities, and really got to see firsthand what the aging process looks like and understand from my clients the emotional challenges that come along with it at every step in the process. And so that was where I fell in love with working with older adults. I spent a few years after college working for the Department of Child and Family Services, and then said I have to get back into working with my one true love, older adult clients. So I started working for a caregiving agency, was there for about 12 years, and decided, you know what? Caregiving is one piece of the puzzle. I'm seeing my clients come with very complex issues, with families that are concerned and really don't know where to turn, with a lot of questions and not many places to go for answers about how to make the aging process easier. And so that's what led me to found the Care Plan as a way to support individuals and families as they either are foreseeing healthcare challenges or in the midst of healthcare challenges, to say this is what's available to you, this is how you can pay for care, and this is how you can keep your loved one at the center of what can be a really challenging cycle of communication.
Right. Thank you so much, Jackie. Really appreciate that. And I'm wondering if you can also share with us a bit more about the Care Plan. And what do you think the Care Plan, where do you think it kind of, in this particular landscape, where do you think it kind of plugs in or fits a need that hadn't previously been met?
Absolutely. Well, I'm part of what's called an Aging Life Care Management Specialist, which is a really long term that basically means a geriatric social worker or patient advocate. Those may be other terms that people are familiar with. But essentially, we're the people that come in to advise and consult with individuals and families about whatever concerns they're having. Some of the most frequent things that I see are questions about competency and housing. So, for example, if someone is noticing that their mother or father is starting to have memory loss, that's an indicator. And as we approach the holidays, I get a lot more calls because people are spending quality time and saying, you know, mom isn't bathing as frequently, she's not paying her bills in the same way, she's repeating herself. And so typically that's what brings someone to our door, is a change in behavior, potentially memory loss, immobility issues, or an unexpected diagnosis.
Gotcha. Thank you. So you were talking a little bit about this, but I'm wondering if we can go into a little bit more depth. Who exactly is the Care Plan for? Like, who benefits from these types of services?
Well, having worked with over 1,000 families, I think that everyone benefits from the Care Plan, because our goal is to meet people early, before you're in a hospital bed, before you're talking about having to move your loved one. the earliest that we can connect with a family, the better their process is going to be. And so when I started the company, I had been doing activism within LGBTQ plus communities for about 15 years. And I said, it's time to marry my passion and purpose. So the care plan serves everyone, but we specialize in the needs of LGBTQ plus communities, which I think improves the process for all of our clients because we think creatively and we're going to find a solution.
Lovely. Well, thanks so much for adding that. And actually leads into the next question I want to ask you. So we know that planning for LGBTQ plus families is difficult. Our healthcare system a lot of times is really based on having children sort of look after us and see what and be a large part of what our aging process looks like. And we know that LGBTQ families are less likely to have children than our heterosexual counterparts, and then also that folks might be out of touch with their children if they do have children. And so, what are the strategies that LGBTQ families can utilize, while aging?
That's a great question, and I want to spend a little bit of time on some of the barriers and challenges that LGBTQ individuals and families face, because it's about the fact that you don't have an automatic support system, certainly, because folks are 3 and 4 times less likely to have children, which is significant, because oftentimes, even if your family is maybe not in love with each other, they still show up when there's a healthcare incident. And so if you don't have that safety net, your care can become critical, and it's really, really hard to find the support that you need. So that's one thing. The other challenge that LGBTQ individuals face by far is a lack of affirming providers, a lack of training within our hospitals and our healthcare systems, and even more so in the aging landscape. I sort of view it as a new road that people are on when they've had their primary care physician, they've had their medical team, they're able to go out to appointments. At the point where you're no longer able to get to your doctor or to live independently, to live in your own home, you're in a whole new landscape. You're in a new city, you're in new terrain, and there's not really guidance around how to do that well. Because also this is the first generation to age out. So these questions are being asked, the research is just starting to be done. And so I think we'll learn more in the coming years about what these barriers are and how to overcome them. For me, when I started the company, and I was so excited to do this work and to identify these strategies, because I know that LGBTQ people are particularly resilient and adaptable. And so what I identified was family of choice is a major benefit for people that is being underutilized. And I think it's a cornerstone of LGBTQ plus communities, but it can be leveraged by anyone to improve their aging process. The more people you have involved in your care, the more people that know that if you're not well, if you don't give them a call, if they haven't seen you in a week or two, that they need to get involved, you're going to be in a better situation. So family of choice is one of the first cornerstones that I encourage people to embrace. I would say the next is to plan early. And the reason for that is because the earlier you plan, the more educated you are and the more informed decisions you can make. So for example, as an LGBTQ person, it may be really important to you to be in a neighborhood where there's other LGBTQ people, or where you can access the groups and services that you've been accessing for years. It may be important for you to be with friends or that family of choice. And that doesn't happen on accident. So it's really critical that people plan early. And then the third strategy that I think is particularly helpful for LGBTQ people is housing. Figuring out the right type of housing for you. There's a lot of different kinds of models out there, but given that LGBTQ people are less likely to have children and more likely to face discrimination within healthcare systems, finding the right community, aging in community so that you have socialization. And that doesn't mean you have to go to a traditional retirement facility or a senior living home, but consider intergenerational housing or communal living with your family of choice, or something like the village model, which will allow you to stay in your home but be supported by other members of the village.
Wonderful.
So.
Thank you so much. Go ahead.
I know some of the terms that I'm using people may not be familiar with. If you have questions, you can definitely get in touch and we'll share my contact information at the end.
Perfect. Thank you so much. So you've listed a bunch of barriers. Thank you so much for sharing those. Is there a common barrier or one that maybe you had just said? And I'm sorry, people. So is there a common barrier that you see that LGBTQ people from aging the way that they want to age? And if there is something like that, how can folks alleviate those barriers?
Well, I think that honestly the biggest barrier is ourselves, and that's for LGBTQ people and the wider community, because our society places such a high price on youth, and our older adults are invisible in a lot of spaces. And people don't ask questions when older adults aren't at the table. And I think that a lot of the people that I've worked with have internalized that. They say, well, I don't want to reach out because I don't want to be a burden to my friends or family. I want to be independent. I've been independent my whole life. I don't want to be taken care of. But what that means is that you are negating choice. You're negating your own choice if we don't embrace the fact that we're going to age. And if we don't try to do that with our loved ones helping us, frankly, because that's how we end up more vulnerable and isolated and have doctors or physicians or the court making decisions for us. And so I think when I talk to people, I really talk to them about claiming aging, understanding that there's a whole fourth quarter of life left after retirement, and really thinking about care planning as the same way that we think about estate planning or financial planning, because care planning is about your life and about your choices, and you can start doing that today.
Wonderful. Thank you so much for laying that out so clearly, I'm sorry. So it's fall now, it's getting colder, and I'm wondering what sorts of things come up for folks around this time of year. We're in October, almost November. What's coming up for folks?
Well, I think a few things. Oftentimes in my elderly population, what I see is people staying home more often and are less engaged socially because it's just harder to get out and about, especially in Chicago where they're dealing with transportation and snow and inclement weather. So I see a lot more people staying home, which gives us who are able-bodied and interested in supporting our older adults the opportunity to reach out more. So I think that remembering that socialization is the number one issue that older adults are contending with, and that loneliness and isolation we can all do something about. So I would say in the fall people are starting to feel a little bit more down because of the shorter days and the lack of, like I said, ability to get out and about.
Right.
We also start to see more health incidents, so things like falls, because people are at home and maybe not eating as well or being as active, lose their balance more easily, things like that. And of course the common colds and flu and pneumonia and I can go on a litany, but I will not. Gotcha. But so I think people are really feel the winter here in Chicago as we age. And so check on your older adults, check on your loved ones, especially your folks that are maybe sticking close to home this season.
Gotcha. And did you also mention, was it Alzheimer's Awareness Month or?
Yes. So November is Alzheimer's Awareness Month, and I think it's such a critical issue because so many families are dealing with Alzheimer's and caring for a loved one with memory loss. And in particular, African American and Latino communities are hit harder. We see higher numbers of Alzheimer's occurrences for our populations. And so I think it's a great time to go get educated. The Alzheimer's Association often has events that you can attend and wonderful information on their website. There are support groups around the city because in particular with Alzheimer's, the length of that disease can vary, but it can last from 7 to 20 years. So if you're a caregiver and you've been caring for someone for that long, you would do well to get support. And so if you haven't been thinking about it, this is the month. Reach out, connect, and find a way to alleviate some of that burden.
Thank you. And also around this time, the Care Plan and Affinity tends to do a little work together. Can you tell us about our upcoming event?
We have been blessed to be able to do a lot of work together.
Yes, yes.
So yes, I'm very excited for the third annual LGBTQ plus Care Fair, which will be happening at Affinity Community Services on December 1st from 11 a.m. to 2 p.m. It's a free event. And what's unique about this Care Fair is that I think it really reflects the needs of our communities. And so Affinity serves primarily women of color, primarily LGBTQ plus women of color, and on the South Side, and there's a lack of LGBTQ plus affirming services. So this is a way to pull together providers to say these are the resources in your area, and we'll also be having 3 different workshops. So and we'll be offering a lunch. So please come on through and spread the word.
Lovely. So the last word. What? Anything else that we should know about?
I think I would just encourage people to really sit with that concept of claiming aging, whether it's for yourself or for a loved one. Only about a third of Americans have completed their advanced directives. This is a major issue that we are overlooking, that we are leaving the decisions that affect our lives to other people and systems that may have no idea or who we are or investment in our well-being. So I would just say, claim aging. Your story can be a positive one. You can age successfully, and I'd be happy to be a partner and support in that.
Lovely. Thank you so much. Jackie, it is always a pleasure having you.
Thank you. Thank you so much for having me, and thank you for the work that Affinity does.
Oh, thank you so much. We appreciate that. Remember, you can find out more about us on our website at affinity95.org, or you can find more about the care plan at care-plan.com. It's writing out,
It's a little complicated.
No. But you can find out more about the amazing work that they do there. We are here the 4th Friday of the month, except next Friday, because of the holiday, we will be on the 5th Friday of the month, same time at 6:30. So we are excited to see you. And so you also know that Affinity is having Black Gold, our 2nd annual casino night. That is next Saturday, November 3rd. We'd love to see you there. You can get tickets on our website, affinity95.org. And the Tuesday after Black Gold is we have an opportunity to vote. Many of us have an opportunity to vote. And we want to remember that if there are things that happen over the past week or over the past however long that has been for you, that is one strategy to help get work done. We're doing all the things that we can at Affinity to make this world a better place for everyone that lives in it. And this is a strategy that we can use as well. So definitely get out there and get out there to vote. Thanks so much. Always great seeing you. And we will see you soon. Thanks.